Hello everyone, Kevin L. Jackson here in San Francisco, and we're here at Upgrade 2023 with Dr. Jon Peterson. Dr. Peterson, thank you for taking the time to be with us.
Thank you for inviting me.
I understand you're doing a lot of work on heart attacks. Is that right?
Among other things, yes, indeed. Yeah, we are developing a digital twin of the cardiovascular system for a human. So a digital twin is just a simulation of something that happens in the real world. So you can think of one example might be of a simulation of a jet engine, where when the engine is going up in the sky, there's a lot of monitoring taking place on that, and that monitoring gets telemetered down to the simulation. And so by the time that plane lands, any issues with the plane, anything with the engine, any issues with that, it's already been simulated, and you can take that information and perform maintenance or whatever. Well, you can now take that into the healthcare arena, and our notion is to simulate an individual person. And of course, not the whole person, but the cardiovascular aspects, so the heart and our arteries and capillaries and veins. So what we can do with that information is we can simulate something like a heart attack, as you said, but we can also potentially speed forward to look at things like aging, and if you happen to come into the hospital for something, we can try out different simulated treatments on that twin and make sure that they're going to work for you specifically before we actually try them out on you as a person. And that way, rather than spending days looking at optimizing a drug treatment, the hope is we can just dial it straight in, and you will be able to recover as quickly as possible. How
can electronics be trusted to simulate how my heart's going to work?
Yeah, the notion of this is actually pretty old. But if you think about electronics, for instance, a resistor. Well, what is a resistor? A resistor is something that resists current. Well, in the cardiovascular system, if you think of a blood vessel, that blood vessel is going to have some resistance to the flow of blood going through it. So we can model that resistance as a resistor. And that vessel has blood in it. So it has a capacity for blood. And so we can monitor, we can simulate that with a capacitor. So just very simply, we can use resistors and capacitors, and not really resistors and capacitors, but the differential equations that allow us to connect up the resistors and capacitors in various ways. The other component that we use actually is a diode, and a diode only allows flow in one direction, which is what your valves do in your heart.
But how do you actually get data so you can test your model?
Right, yeah, there are a couple of different aspects of that, and one of them is the model set up correctly, right? So we need enough data so that we can test whether all of the resistors and capacitors, all the components, make sense where we put them in our model, and also the parameters, the values for each of these components are the correct ones. And so we have a couple of ways of going about that. And one of them is there is grand tradition of appropriately using small animal experiments in the healthcare research forum. And so we have access to prior data on that, as well as the ability to do more experiments if we need them. But then the issue with that is, once we've gotten everything to work, how do we scale that up to a whole human? And there is actually a fair amount of literature on how different things scale with size. And so, at least in theory, once we have it all figured out, we can go from a mouse to an elephant. And so maybe the veterinarians will enjoy our work at some point as well. But we can also look at human data that we have right now. And so the way forward with this project right now is we're going to start off by looking at people that are in acute care settings. So for instance, the heart attack that we had talked about.
Right.
And when they're in, let's say, a coronary care unit, they may well have a catheter that's inserted into their aorta. And that allows for measurement of pressure and flows and all of the sorts of things that we need to be able to characterize the model.
So one of the things that really surprised me is that you're using electronics to actually model the heart, but clearly that didn't surprise you. I'd be very interested in understanding what has surprised you in this work.
Yeah, this the notion of using twins is not so surprising because that's grown up in other industries. But one of the things that did surprise me as I was testing out different scenarios on this, and again, this model is very early on right now, and so we're not ready to implement this yet. But when I was looking at implementing a simulated heart attack, one of the things that really surprised me was how quickly I could kill my simulated patient.
Oh, wow. That's not too comforting.
Yeah, that's right. So it's a bit of a wake-up. But what happens is once you've constrained a coronary artery, the heart muscle is not getting enough blood now. And so it starts to die in some sense. It can't contract as hard. And so now, as it's not contracting as hard, your overall pressures, your arterial pressures, and you think of them as systolic over diastolic pressures, they start to go down. And so that means that not enough blood is getting to the rest of your body. But it also means that the amount of pressure that is essentially forcing blood through the coronary arteries is going down. Okay. So you have a slightly constricted artery, and now you have less pressure to push the blood through. So that just made the situation worse, which means that the heart dies a little bit more, and the pressure goes down, and there's even less flow going through. So when I was simulating it, I was a little bit shocked at how quickly I could make things happen badly.
So will you be able to use this for other organs of the body?
We're starting off with the cardiovascular system, but there are a lot of other organs that affect the cardiovascular system. And so we'll be having models of them as well. And an example of that would be your autonomic nervous system. If you exercise, then the sympathetic nervous system kicks in and your heart rate goes up. The ability of your heart to pump will go up as well. And so there are various factors that the sympathetic nervous system helps to control, including actually the resistance to flow through your arteries. So that's going to be an important system. We're going to be implementing a kidney. And the importance of the kidney is several-fold. First of all, that's how one of the ways you regulate volume. And so if you pee out all your volume, right?
That's probably not good.
Yep. And so diuretics, for instance, are something where if you are in heart failure and you're congested, there's too much fluid on board, you use diuretics to be able to pull off some of that volume. And so we'll be able to model the effects of diuretics on people as well. So we're also going to have a lung.
Okay.
And now all of these things, though, are implemented in a way, you think to yourself, there's a lot that goes on to modeling a lung, right? Well, we're not going to model the lung except for how it's going to interact with our system, all right? So
within the heart or?
Yeah, so within delivering oxygen, or also the pressure in your chest. When you think about it, how are you breathing? You're actually creating a vacuum in your chest, and that's expanding your lungs and pulling air in. And so that's an intrathoracic pressure that's going on there. And it turns out that pressure actually also affects your vasculature, because some of your veins and arteries are in the thorax. And so their pressures are going up and down a little bit as you're breathing.
And that affects your circulatory system.
And so all of those components are going to get added in, but we think about them, at least at the moment, as ways to change the values of those resistors and capacitors and things in there. So they'll have an effect on them.
that makes sense. But one of the biggest announcements during the event is ION. So how does this really link to ION? I mean, the heart simulation and everything.
Right. I think that the best way to look upon it is in an everything connected world.
Yeah.
Then you can imagine once we've made it past these preliminary studies where we need really detailed and very invasive measurements to be able to match it. At some point we'll be able to use a smartwatch or some other, or a ring or other technologies that are perhaps always connected, right? And so that data can keep feeding into your simulated twin and provide information on a real-time basis, because the model can run in the cloud. And so for scale, that would be the most appropriate way to do it.
I guess it's also sort of similar to how different digital twins interact with each other in ION. So my digital twin of my heart could interact with the digital twin of my lungs, for instance.
Yeah, and as we develop those, and actually another thing that this sort of system, you sort of brought up the notion of a population of people in some sense, and we can use that actually to run digital clinical studies. So we can test out potential things on digital populations before anything ever makes it to a real person.
This event is all about, upgrading reality, right? So when will your work upgrade my reality?
So we're looking at this in stages right now. And again, we're going to start off with very sick patients because honestly, we can get the most data from them. But also we had the most potential to do good with them, to be able to help someone who's had a heart attack or is in heart failure and has to go into the hospital. So we're targeting that to begin with. And honestly, it'll probably be 10 years or so before that is effective enough to make it out. And we would probably do that as essentially a decision support something for a clinician to start off with, so they could consult a model and say, oh, okay, that the model is suggesting I do a certain thing to make this person better, but then they still have the opportunity to exercise their clinical judgment as to whether that's an appropriate thing or not. And then over time, we'll be able to add on so that we can start to use those smartwatches and rings and such, so that we can eventually make it so that we can start to look just at wellness, keeping everybody healthy, instead of treating someone that is not healthy. So that's the whole continuum, and that's probably 20-ish years away, just because there's an awful lot of work that has to get done to realize this in a way that's, of course, safe for the patient. And
Well, thank you very much. I'm looking forward to hearing more about your work.
Thank you very much, sir.